rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, and Pennsville. I'm Joe Chapana. We are live for the next half hour. Tonight we're going to be talking about back and neck injuries. So if you are having problems with your back or your neck, we urge you to watch for the next half hour. Also, you may want to take advantage of the free evaluation offer being made by Cross Keys Physical Therapy. At the end of the program, we'll give you numbers to schedule an appointment for that. Right now, let's give you these numbers to reach us live with your question. 1-888-634-7488. Locally, it's 856-767-8884. We also have an email address. It is wpsjtv@aol.com. And tonight, to answer your questions, we have Dr. Stephen Valentino, who is a board-certified orthopedic and reconstructive spine surgeon. He has offices in Turnersville and also King of Prussia. And next to him is Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy Sports Medicine Center. Welcome to the program, gentlemen.
Thank you.
Dave, we'll start with you. If we can get a brief anatomy of the back.
Sure. This is the vertebral. This is the front, and this is the back over here. And we're starting at the top, which is the cervical vertebrae. There's 7 of them. This is the light green. As you go down here to the darker green, this is the thoracic vertebrae starts here, and there's 12 of them. As you go down the level here, and when it turns to a teal color, this is the lumbar. And these are vertebral bodies in between, and the little white color or clear color things, they're the discs in between each and every one. And the yellow coming out is the nerve roots coming out. As you come down here, this is the sacrum, and this is the ilium, and this is what they call the SI joint here as well. This is the disc, the vertebral in between each and every one of them. There's a disc. And inside that disc is a nucleus, and around this is an annulus fibrous ligament around that disc. And this is the vertebral body, and once again, this is the spinal cord, and these are the nerve roots coming out.
Okay, and these are some of the things we'll be talking about tonight. We'll be talking about back and neck pain. If you have questions, 1-888-634-7488. Dr. Valentino, what do you think is the #1 cause of back pain?
Well, I would say the #1 cause of everyday back pain and stiffness, and I'm talking about you get up in the morning and the back hurts and it's stiff, or perhaps it acts up after a weekend of activity, is probably a combination of some of the disc wearing out, and we call that degenerative process, combined with some deconditioning of the muscles, and that combination can lead to those sort of common type of low back complaints.
And is this something that just happens naturally with age, or?
Yes, the disc can sort of start to lose its water content, and it gets replaced with other proteins that don't have that same affinity for water and begins to dry out, and we call that disc desiccation. So the disc, which are really, you should think of as a shock absorber between the bones, they start to sort of lose their shock absorbing capacity, and that's just something that happens naturally.
Okay, and when you hear disc, you always hear bulging disc, herniated disc, slip disc. Are these the same things, or is there a difference?
No, there is a difference. The disc, again, if you think of it as a shock absorber, and if I just kind of show you this model, the disc, I always tell patients to try to envision this as perhaps a miniature jelly donut. Okay, the outside of the disc, or the dough, is called the annulus, and that's sort of a thick, fibrous type of structure. The inside is the nucleus, or the jelly of the jelly donut, and that has the consistency almost like of crab meat, if you will. And that's the normal architecture of a disc. As the disc begins to lose some of its shock absorbing capacity, it can bulge, just like squeezing a balloon between your hands. It can bulge at its side. And if you have tears in the outside annulus, or tears in that dough, if you think of the jelly donut, some of the interior nucleus can herniate out or slip out. And that's the definition of a disc herniation or slip disc, and those two are exactly the same thing. The problem is when you have a disc herniation or slip disc is it can start to impinge on the nerve and give rise to leg complaints.
Leg complaints. Now what is meant by sciatica?
The nerves that exit the low back go into the leg and form a large nerve called the sciatic nerve. So when someone has a pinched nerve, whether it be from a herniated disc or perhaps some bone spur formation, and it causes back pain shooting into the leg with numbness and weakness. That's what we call sciatica. That means that nerve is irritated.
So a problem in the back can actually be experienced in the leg.
That's right. When you have nerve irritation, the common complaints are back pain radiating into the leg.
Does it go the other way? I know tonight we're talking about back and neck injuries.
Yes. No, it actually doesn't. The nerves transmit in one direction.
Okay, we're talking about back and neck injuries tonight. You're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. Back pain and neck pain sufferers, we're available for your calls. 1-888-634-7488. Our first caller is from Washington Township. Is it Julie? Julie, are you there?
Yes, I am.
Hi, how's your neck or back?
Okay, first thing I want to say is I was diagnosed with a herniated C5 disc and a severe degeneration of C6 and C7 on January 13th. I had 3 injections under fluoro. I was in severe pain for 2 months. I went to Dr. Valentino for a second opinion. My hat goes off to you, Dr. Valentino. In my eyes, you are an outstanding doctor, and I want to thank you for recommending Cross Keys Therapy, and I want to thank Dave and his professional staff for the huge improvement of my condition today.
We appreciate the
Good.
call.
Very nice. Thank you.
Thanks so much for calling.
Thank you.
Talk a little bit about her condition. What was she like when she presented to you?
Well, she had a problem in the neck, and that was a disc herniation, and it was causing pressure on the nerves that exit at the neck. Now, we talked about low back pain radiating into the leg. When you have a neck problem, that can cause neck pain radiating into the arm with that numbness and sort of weakness feeling. And that was exactly her problem. She was actually very close to having surgery because she had all the right findings, all the right conditions. And we first tried some injections and physical therapy, and fortunately, she made significant improvement.
Okay. Thank you for calling. Thank you for sharing that success story. Our toll-free number is 1-888-634-7488. It's neck and back pain tonight. You're watching Sports Doctor. Our next caller is Emil. Emil, welcome to Sports Doctor.
Thank you. I got a question.
Go right ahead.
I went skiing a couple weeks ago. I'm a 45-year-old male. Never had a back problem in my life. Skied all day Saturday. Went back, entertained. Sunday morning, bent over to pick up a pair of socks and went into excruciating pain. Since then, I was on meds for about 3 to 4 days, muscle relaxer and a arthritic,
Okay.
Anti-inflammatory.
And for about 3 to 4 days, I was okay. I got off the meds, and then I'm a laborer. At that point, I felt pretty good, so I went back to work, and I hurt my back again. Now, I'm still right back on the meds. Now, do I go back to my doctor and continue with meds? Do I get a chiropractor, or should I get some sort of,
Okay. Any advice for this guy?
Yes, well, what you're describing is back pain, probably after skiing, and then all of a sudden just bending over, doing something seemingly so trivial or simple, and then it'll cause this really bad episode of back pain. Got a little bit better, thought you were sort of turned the corner, got back to work, and boom, here it is again. Depending on whether you've had any conservative care, that might be the way to go. Rest and medication can offer some improvement, but really only a limited amount of rest early on, particularly if it's just back pain and not accompanied with any leg pain. And I think it's wise probably to go back to your doctor, have him do another evaluation, find out exactly what the cause is. So much of getting better is understanding the anatomy. If you understand what's wrong, you can understand why we're doing what we're doing to get you better. Whether it's a disc problem, perhaps just a tear in the disc and not actually a herniation. Perhaps the facet joints, which are kind of like shingles on top of one another, and there are 2 at each level in the low back. Perhaps that's the culprit. But I think because you're a laborer, you're going to need a strong back, and considering your age, it sounds like you're going to need another 50,000 miles out of this low back. So we really I think need to get you properly diagnosed and properly treated.
Okay, Emil, maybe you could take advantage of that free evaluation offer at Cross Keys Physical Therapy, and we will give you the numbers for that at the end of the program. Right now, though, you can reach us toll-free, 1-888-634-7488. Our next caller is from Princeton. Let's say hello to Rob. Rob, welcome to Sports Doctor.
Thanks a lot, guys.
Sure.
Great topic. I have a problem that I'm facing my third operation. I started off with an L4-5 herniation. I ended up with a fusion in that area. Now I have degenerative discs from L1 to L4 and L5 to S1. Now, it's been 12 years since my second operation, and I've been told that I have L5, S1 nerve damage now. And that's the problem I face. I have a couple weeks to decide whether I should have my third operation at L5S1 for this nerve damage. Can you guys give me some help here?
What is the intended procedure that the doctor's recommending? Is it a discectomy to go in and remove a herniated disc, or to do another fusion at that level?
He can't do another fusion. He wants to go in the S1 region and work on the nerve damage that I have.
Okay, so it sounds like that he wants to do what's called a lumbar decompression. Basically, and this is a surgery where compression is taken off the nerve, whatever is causing the compression, whether it be a disc herniation or bone spur or perhaps even some scar tissue. If you're looking at your third surgery, I'd really approach that very tentatively, okay? Because the results with multiple surgeries, the success rate does seem to go down. So you want to make sure that you exhaust all other possibilities. And of course, this would depend on what your MRI shows and what your complaints are and what the exam shows. So I would say that if you're looking at a third surgery, I would make really sure that I exhausted all the things before surgery and consider only the surgery once you've done that. And I'm talking about whether it be different medicines, injections, physical therapy, perhaps bracing. So you really need to sort of go through all these things, and if surgery is the last resort, then it might make sense.
Dave, talk about the physical therapy option here.
Yeah, well, I mean, like the doctor said, I don't know whether he had physical therapy before or if he hasn't. Really, it's real important, especially after having a surgery of your lumbar spine. You really need to understand the integrity and the importance of support. And support is really strengthening abdominals, abdominals and your back extensions to form what they call a normal lumbar corset. Like the doctor said earlier, sometimes they put braces on patients to help support that area early on. But realistically, we really want to establish your own natural strengthening and to support that area so you don't have to wear that back support, because we know the more you wear it, the more dependent you're going to become on it. So you really want to have develop your own. So just a general strengthening of the abdominals and back extensors and doing overall strengthening of the body, but really concentrating on those areas are very, very important to do.
Rob, thank you for calling and thank you for watching. Sports Doctor brought to you by Cross Keys Physical Therapy. Toll free, you can reach us. We're talking about neck and back injuries, neck and back pain. 1-888-634-7488. Let's go to West Hampton and talk to Michael. Mike, are you there?
Yes, I am.
Hi.
Good evening.
What can we do for you tonight, Mike?
I like a little information.
Okay.
I have a degenerating disc, the third and fourth, and I have pains that runs up and down my left and right leg. And if I lay down, it seems like the pressure builds up on my right side and get into a knot. If I stand and be washing dishes, I have to sit down to take the pressure off. And I had 2 epidurals. And the doctor told me that I would have to have operation, but he wanted me to lose weight first. And it seemed like when I had the steroid, the injections, that my weight ballooned up. So is there anything you can tell me to help me?
Any suggestions for Mike?
Let me ask you a question. Where is your leg pain? Is it more in the front, the outside, or the back of the leg, or just simply all over the leg?
It's in the back of the leg, running down the thighs, and the buttocks on both legs.
Yeah, if it's in the back of the leg, that nerve that supplies the back of the leg doesn't come out at the 3-4 level. That's more at the L5S1 level, the last disc level. So that you may be having the problem related to the degenerative disc disease or disc just sort of wearing out, but the leg symptoms sort of don't match the level where you have this. So I think you probably need some other investigation, perhaps some other testing. I would not rush into surgery just for the few things that you've told me. Certainly weight loss and smoking are two bad things to do for the back, and both of them will lead to pre-accelerated degenerative changes. Your back will simply wear out a lot quicker with both those findings. Smoking has to do with a poor circulation, and the weight, I mean, you're just with this extra weight that you may be having, particularly if you have it mostly in your stomach, you're just asking your back to just work overtime, and that can lead to it wearing out a bit sooner.
Mike, thank you for watching. Thank you for the phone call. Again, we'll have numbers at the end of the program, the free evaluation offer from Cross Keys Physical Therapy. They're in Sicklerville, Woodbury, Washington Township, and Pennsville. You can reach us live right now, 1-888-634-7488. Our next caller is Bill from Pennsylvania. Bill, are you there?
Thank you, gentlemen, for taking my phone call.
We're glad to have you.
50-year-old male, have recently gotten an MRI of my cervical spine. Basically, neural tube looks pretty good. C1, C2, C3, maybe some narrowed, some collapse of the discs a little bit. No annular bulging or ripping. No evidence of herniation. I'm getting straightening. C1, C2, my spine, instead of curving forward, is straightening. The nice radiologist that read the film said that may have been positional, which I believe it to be. But here's the deal. 2 serious traumas to my head, 15, bottom of a swimming pool, thank God, not cripple. Motorcycle accident on my head at the age of like 36. So I've really been good, no pain. Chronic Lyme disease. Now what I'm experiencing, Lyme's almost gone, still hanging a little bit though, right? I am getting pains that radiate crown of the head on the right side, crown of the head on the left side, right mandible, right lower neck. Last night I could not stop the pain on the crown unless I pressed my head against the wall when I was in a prone position. I could be driving down the road, can't turn my neck to the left.
Can problems like in the mandible and the head, can that be related to the neck and the spine?
Yes, well, jaw pain and particularly headaches. I mean, there's, like 100 different reasons patients can have headaches, but one of them is problems emanating in the neck, which just may be the cause. And if the headaches are the main part of these symptoms that you're complaining about, it might be a good idea to first see a neurologist and just make sure, just be absolutely certain that nothing else is being missed. If it does seem to be coming from the neck, there are some different types of blocks that can be done, which seem to be very effective, particularly a C3 nerve block coming in laterally, and just injecting just a little bit of cortisone and perhaps some numbing medicine can really just break this inflammation cycle and seems to have a positive effect.
Okay, Dr. Steve Valentino with us, board-certified orthopedic and reconstructive spine surgeon, Turnersville and King of Prussia, and also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, Washington Township, and Pennsville. Our next caller is Nancy, who is from Pennsylvania. Nancy, what town are you from?
Moulton.
Okay, what can we do for you tonight?
Okay, I have a T10 fracture from 1994 in an automobile accident. And I've been told by so many different doctors there's absolutely nothing they can do for me. And this is very disturbing because I live in pain. I've gone to pain management specialists and gotten the injections from the accident, the C3. I have a slip disc, and throughout the years it's a crushing effect. I'm 45, so with age also, I have low bone mass, and in L4, 5, and S1, I've got problems now. I have a lot of pain down my legs. They tell me there's nothing you can do. I've been given lots of medications. Basically, Hershey people told me, whatever you do, don't ever let any doctor touch it or operate. And they tell me I should kiss the ground I walk on and just be glad I'm alive. When they see my MRI, all the different neurosurgeons that I've been to. Well,
let me ask you, because you described problems throughout your spine, in the neck, the thoracic spine, which is the upper back, and the low back, which is the lumbar spine. Out of all the things that are bothering you, what do you think is the most prominent? What do you think is the thing that bothers you the most? What area?
The muscles around where the bone was broke.
Okay.
And then from there down, I have my most pain in my right hip and down my right leg.
Okay.
If it's the area where you had the fracture, the T10 vertebrae, what happens with a bony fracture is, if you just look at this vertebral body, it collapses, okay? And it doesn't go back to the normal state. What it does is it typically heals in that collapsed type of scenario. So, I mean, if your fracture was so long ago, one would think that by now it's certainly healed, but because of that abnormal shaped vertebra, that can put a lot of stress on the other vertebra above and below it. So the first thing I would probably look at is this area and see if that's not the problem, because it's basically a deformity now because it's so collapsed, and the positioning of your spine above and below that are trying to compensate. And you know, certainly with all the problems you have, one surgery is probably not going to do it for you. I would really get back to maybe getting some new tests, and again, if you can work up these muscles around the spine, this will really support this. And if you look at what you have in your spine as a weakness, you're not going to strengthen anything else other than the muscles. And that is probably a key for you if you can do it.
Dave, talk about strengthening those muscles.
Yeah, exactly. Like Doctor says, you really need to strengthen. It doesn't only work on the lower, but it works through the whole spine. So strengthening these muscles, you really need to get into see a specialist, to a physical therapist in your area that could help you to take a look at those areas that are weak and work on those areas to give you better support to take some of the pressure off that fracture.
Okay, we're talking neck and back pain, neck and back injuries tonight. You're watching Sports Doctor. We're taking a short break. We're coming back with more of your calls. You can reach us toll free, 1-888-634-7488. More right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
And Cross Keys Physical Therapy Sports Medicine Center proud to bring you tonight's edition of Sports Doctor, also offering free evaluations for the next 2 weeks. At the end of the program, we'll give you numbers to schedule an appointment if you'd like to take advantage of that offer. Right now, this number, 1-888-634-7488, with your question, neck and back injuries tonight. Our next caller is from Laurel Springs. Let's say hello to Rob. Rob, welcome to Sports Doctor.
Hey, how you doing, doctor?
Hi, how are you?
I was recently involved in a motor vehicle accident. I was riding a bike and hit by a car.
Okay.
I was diagnosed with, I believe, is sacrum reticulopathy. Exactly what is it, and is the damage permanent?
From what I understand, I think you're saying a sacral radiculopathy. Now, radiculopathy is a fancy word that means a damaged pinched nerve, and the sacral region would likely be the S1 nerve root, and that would give you back pain shooting down the back of the leg and all the way down. It can go as far as the outside of the foot, and with some associated numbness and weakness. And it would depend on what component of your pain is worse, whether it's the back or the leg, and also what your imaging studies show. For example, MRI, is there something causing compression on it? Most of the time, these things are not permanent and can get better, whether it's conservative or surgical management.
Rob, good news, and we're taking your calls at 1-888-634-7488, neck and back injuries. Jim is our next caller. Jim from Washington Township. Jim, are you there?
Yes, I am.
Hi, what can we do for you tonight?
Well, back in '79, I broke my neck at the odontoid. I broke the cup completely off, and I had a spinal fusion. And ever since then, I've had lower back because I can't turn my head all the way to one side. Can't sleep on my stomach anymore, things like that. About 3 years ago, it started going out quite a bit. I went through the epidurals, all of that stuff, and then about a month ago, it went out again real bad. I went in, seen a orthopedic surgeon. They sent me over for MRI. Went back to him. He said I had a herniated disc.
Okay, we're running out of time, so you got to get right to your question.
And they were wanting to do surgery. What's your opinion on that?
What bothers you more, back or leg pain?
Back or leg pain or neck pain? Are you there?
Yes.
Back or leg pain? Which one bothers you more?
I'm having the leg pain also, but leg pain goes into the groin area.
Okay. The first part of your what you're saying has to do with that C1-2 fusion, which is done for endontoid fractures. Endontoid is actually another name for that C2 vertebra, and that is fused, and that's probably solid, and that will limit your rotation. Okay, but that probably has not too much to do with your current back and leg problem, which seems to be due to a disc herniation. And the treatment options for that would be normally starting off with some physical therapy, rest, medication. That's sort of phase 1. Phase 2 is to consider some injections, and it sounds like you've had some of those already. Phase 3 would be to consider surgery, but you have to have the right indications to make you a good surgical candidate. I mean, you don't want to have surgery unless you're going to have a good result. So if you have a lot of leg pain, numbness, weakness, and that's consistent with a disc herniation causing pressure on that nerve, if everything is dovetailing together, then you may just be a good surgical candidate.
Okay, thank you for watching. Thank you for the phone call. Sports Doctor brought to you by Cross Keys Physical Therapy Sports Medicine Center. They are offering free evaluations for the next 2 weeks, and we're going to give you the numbers now to schedule an appointment to take advantage of this offer. That's all you have to do is call, make an appointment. To do so at the Sicklerville location, it's 856-728-1900. In Woodbury, it's 856-853-0988. Washington Township, 856-374-3707. And in Pennsville, it is 856-678-8000. Do we have time to take Ray? Ray, are you there?
Yeah, I'm right here.
Go right ahead with your question. Real quick.